Hi, my name is Juliana, and I'm going to talk about the Zika virus. Aedes aegypti, it's the mosquito that transmits Zika virus disease. They became infected when the female bites someone that have the virus. They are different from regular mosquitoes, having white dots all over their bodies. They are originally from Africa, but now they are present globally. They were spread because of the globalization, where mosquitoes infected people when they traveled to other countries. What is it? Causes and effects. Zika virus can be transmitted by sexual relations and mosquitoes. The symptoms include fever, rash, muscle and joint pain, malaise, and headache. In this slide, I put an image showing how Zika is spread, and this way you can protect your family and community. It shows the common way that you can get Zika and the less common ways to get Zika. The less common ways are during pregnancy, through sex, and through blood transfusion, and the common way is when a mosquito bites someone that is already infected. Where did the first outbreak happen? The virus was identified in Uganda in 1947 in monkeys and just in 1952 in humans. The first large outbreak happened in 2007 in Africa and Asia on Pacific island of Yap in the Federated State of Micronesia. In Brazil, the first notified case was on the 2nd of March 2015. A year later, microcephaly was associated with Zika virus. This led to Brazil declaring a national public health emergency in November of 2015, followed by a similar decision by the World Health Organization 3 months later. This rapid spread was probably due to a combination of factors, including a massive susceptible population, climate condition conducive for the mosquito vector, alternative non-vector transmission, and a highly mobile population. This epidemic has since subsided, but many unanswered questions remain. In this slide, I put two maps, ones that show just in South America, where did outbreaks happen in South America, and the other one shows outbreaks all over the world and the year that happened. Here I show how we can prevent the virus, and the most important ways to prevent is avoiding mosquito bites, still water, and protect during sex. Pregnant women and microcephaly. How to prevent Zika virus? It is recommended that pregnant women should avoid mosquito bites and always wear repellent because Zika can be passed to the fetus. Infection during pregnancy can cause malformation called microcephaly in babies and other severe fetal brain defects. Microcephaly is a condition in which a baby's head is significantly smaller than expected, often due to abnormal brain development. How do they survive? Microcephaly has different levels as well as many orange for the problem. Some cases are so mild they cause almost no complications. Others are so severe that lifespans range from a few months to 10 years, depending on access to medical care, among other factors. How do they live nowadays? As I said, some cases are not that complicated, but a lot of them need physiotherapy and medicines, and it's very difficult to families that don't have enough money to pay for those medicines. There is no cure or vaccine for Zika virus infection. It is hard to develop a vaccine because of a special feature of this virus. Instead of vaccine, some scientists decided to introduce ready-to-go antibodies that could neutralize the infection.